Okay, so this is my case presentation. Okay, so the agency I am working for is Greater Vision Outreach Ministries. The population that they serve is families who live in poverty, who may be homeless, less fortunate, sometimes the elderly as well. It just really all depends on the person's situation, if they're homeless, if they have to drop everything and leave. Those are really the kind of people we work with. And so my client today is, I'm going to call her Denise Warren. A little bit of background information about Denise. Denise is a 30-year-old single African American woman. Her religion was not specified. She speaks English. The highest level of education is she completed the 10th grade. She is currently unemployed, and she has a history of depression, anxiety, and schizophrenia. She has 3 children, one being Aiden Warren, which is 3 years old, Asia Warren, which is 10, and Michael Warren, which is 7. She was referred to our agency by the Salvation Army. The date of our first contact was September the 10th, 2019. Some of her strengths and challenges. Some of her strengths include taking care of her children. She's a good cook. She has a positive attitude. Some of her challenges include struggling to find stable housing. She's low on food and clothing for her and her children. She does not have stable transportation. And Denise also mentioned that she has difficulty finding a job and that she needs transportation of some sort to get to and from work, which is why she has been unable to go to like job interviews and more. Presenting the problem. So during our first initial visit interview, Denise stated that she was homeless, and of course she had 3 children under the age of 12. She also informed me that some days her and her children had to sleep outside because of the homeless shelter's strict curfew rules. Denise also confirmed that she had been homeless for 3 months as a result of being evicted from her home. The reason for her being evicted was because she was not able to pay her bills on time. And it's only so much help she can get from others. And she also informed me that she was a single mother with a part-time job as a waitress. She stated that some days she would barely bring home $20 tips. And so eventually, of course, she ended up losing her job due to being absent on many occasions. And this is also because she struggled to find transportation to and from work. So some days she was unable to work. Denise and I met 3 times a month. During the times we met, I conducted an assessment, helped her set goals, helped her find employment, housing, as well as provided tips and tools for her younger children during her stressful experience. During our first initial assessment, Denise showed signs of depression, anxiety, and fear. It appears that she may have had a mental disorder, which was already discovered in the beginning. Denise stated that she wanted a better life for her and her children and that they should not have to suffer because of her wrongs. So the intervention and theory I chose to focus on. The theory I chose to focus on was the group psychotherapy and family therapy theory from Alfred Adler. This theory is important because it not only will focus on Denise, but it will also include her children as well. Her children have experienced trauma throughout their childhood, and watching their mom struggle was one. I think Adler's idea of family therapy could help improve the emotional distress. This theory focuses a lot on children as well. With Denise's children being so young, I think this therapy could benefit them and improve their individual psychology. Adler believes that being involved in group therapy with children will more likely result in successful outcomes with the support from parents, teachers, and social workers. It is important to understand what a child is going through as well so that the repeated family pattern is not created. Through psychotherapy and family therapy, it helps establish the steps needed to take in a client's life. So, with this, not only would Denise be able to be included, but her children as well. And this will actually help their mental state of mind, and also help us to be able to understand, like, what steps do we need to take? What treatment do we need to provide for them? The treatment could include therapy. It could include certain medication. It could include, for instance, for the children, it could include moving to a different classroom, receiving additional help than they're already getting, and more. And so this is actually my focus / intervention. So engagement. Of course, first I would inform her of her confidentiality and how anything that she says will not be used against her or shared with anyone. I would also make her feel comfortable, kind of breaking the ice in a sort of way, such as, maybe asking her about her children and how school, or something just to get her comfortable and get her started to being able to share with me. And I will probably try to find a connection to where me and her could relate, and then kind of base it off of that. And my use of language and words, I would definitely be careful, being that she could possibly, be a mental health patient. Assessment of personal history, such as birth order and childhood memories. This is very, very important, especially when looking at the psychotherapy sessions. Group psychotherapy is important to understand, okay, what was your childhood like? How did that go? That could be the root cause of what Denise is going through today. So it is important to assess her on her personal history and childhood memories and insight. This will be helping Denise basically view her situation from a different perspective. And when I say view from a different perspective, I would say, I would kind of encourage her and let her know that, this might be the way it is, but there's always, people here to help you, people here to, I would kind of put myself in her shoes. Reorientation. That would be suggesting and helping her set active goals or steps outside of our meetings and start learning more about herself and seeing her capabilities. So maybe I get her to, for instance, write in a journal, write positive things on one side and maybe negative things on the other side that she feels about herself. And then our next meeting, I would go over those things, and we would most likely discuss, okay, how do you think you can improve this and make it positive? How certain things like that, like things to make her feel better about herself, things for her to work towards. Okay, so some of her goals were to finding, some of the goals we said, some of the short terms included finding a stable home for her children, obtaining employment, start writing her thoughts and feelings in a journal, and a long-term one was to start family counseling through referral. And some of the outcomes included, Denise was approved for housing on the campus of Baptist Children's Homes of North Carolina, which Greater Vision Outreach is actually on the campus of Baptist Children's Homes. They have like 13 campuses in North Carolina. She was able to find employment and was approved for daycare vouchers for her children. And also the daycares are actually located right by the housing, which is on the campus. So that made it easier for her to be right close to her children. She didn't have to really worry about transportation as much because she was able to get transportation as well living on the campus of Baptist Children's Homes. She did not have to worry about housing for a while she was on the waiting list for an apartment. She also began therapy and has begun to receive help she needs as well as her children. So some of the cultural and societal impacts. The lack of resources available throughout the community, such as there weren't many homeless shelters. There might have been like one. There was very little advocacy for the homeless as well. There were very high levels of poverty. There are really barely any low-income apartments in the area. So that makes people sit on waiting lists even longer. The lack of resources available for mental health facilities. And this also goes along with trying to get health insurance. And, well, that goes to my next one, trying to get health insurance and struggling to be approved, even though she is a single mom. She wasn't aware of many of the resources available for her, such as the food stamps, applying for them, like getting the kids free daycare vouchers, things of that nature. So when she was at work, her kids would be at school. And that's kind of how that went. I was wondering, like, why didn't the school look into it as well? But I guess, some teachers, some schools, they send kids home every day when they don't have a home. And sometimes they're not aware. Sometimes they're aware. So it just all depends, I guess. And that's the end.